Ladies and gentlemen, our program will begin in just a few moments.
Are you going to come up here? Good evening, everyone, and welcome to our presentation tonight. I'm Dan Bevels. I'm Public Relations Manager for the Floyd Healthcare System, which includes Floyd Medical Center in Rome and Polk Medical Center here in Cedartown. And we are grateful to be here with you tonight, both in person for those that are gathered with us at the College and Career Academy, and those also of you that are watching online tonight. We're very grateful that you take the time to join us as we talk about a really serious subject. The past year obviously has been difficult for everyone, and in many ways maybe even more difficult for the students in our school system, and we've seen that with incidents that have happened recently in Polk County. It's a very tragic incidents, and when that happened, Ms. Atkins and Dr. Thomas reached out to us and asked if we could put together a program that just helps their students and those that support their students understand the warning signs and the things that could lead someone to consider suicide. So we've worked over the last several weeks to put together this program, and we've got some great experts that are going to be joining you tonight and presenting some information that we think will be very valuable, and then also taking a few moments to answer your questions if you have those. So we'll do that a couple of ways. For those of you that are gathered here tonight with us, if you have a question, you can certainly ask that. We'll have time for a Q&A session toward the end of the program. If you have something that you'd rather not ask in person, if you want to jot it down and just signal for one of us, we'll pick that up, and that way you don't have to stand and ask the question. We'll do it that way. For those of you that are online, feel free to click on that YouTube link that you're watching, and you can use the comment section there to ask questions, and we'll ask those when we get to the end of the program as well. So there are a couple of ways you can ask questions. And then if you would rather not ask questions either of those two ways, you can certainly always send us a message via Facebook, on our social media, to either Floyd Medical Center or Willowbrooke at Tanner, who's here with us tonight also, or through the school system, and we'll answer those questions as well. So tonight's presentation will be presented in partnership with the Polk School District, Polk Medical Center, as part of our Live Well Polk program, and Willowbrooke at Tanner. And Willowbrooke provides the school counselors here in the Polk school system, and they do a great job there as well. And then we have folks from Floyd Behavioral Health who are part of the Floyd Medical Center system. We'll tell you before we get started that everyone you see on stage tonight has been vaccinated, and it's tough to present wearing masks, so they'll step up and we won't be wearing masks, but I can tell you that they've all been vaccinated. So with that, I want to introduce our panelists and then get started. First of all, I'd like to introduce Amanda Black. Amanda is the outpatient program manager for Floyd Behavioral Health. With her is Holly Marks, who is an assessment manager for Floyd Behavioral Health, and Monica Burge, who is a primary therapist for our outpatient services at Floyd Behavioral Health. And then on my far right is Deb Price, who is program manager for Willowbrooke at Tanner in Villa Rica. And Deb was part of a program that some of you may have seen a few years ago that we did here at Polk County that was, I think, was a tremendous help to everyone. So thanks to the four of you for joining us tonight and for working so hard over the last several weeks to put together the program. So with that, we'll go ahead and get started. And again, we encourage you to ask questions if you have those, but more than anything, reach out if there's someone, if you have a student that needs help, we want to help. So turn it over to Monica, or just go ahead and roll the video. Okay, Ben, if you'll go ahead and hit spacebar on that presentation, we'll just go straight to the video.
Or getting really mad, not able to sleep, or I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy.
I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual,
Acting really down, crying all the time for no good reason.
Or getting really mad,
not able to sleep, or sleeping too much,
Shutting her friends out or giving her stuff away.
acting reckless, drinking, using drugs, staying out late.
Suddenly not doing stuff he used to love.
or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed. Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself.
It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it
I wish he'd come to me.
I wish he'd said
I
something.
wish I'd said something.
when it's too late. So if you think your kid's acting different,
Good evening. I think we kind of can get the gist. What we want to talk about this evening is a pretty serious matter. It's something that over the past year, this community has certainly had to deal with more than its share of. We're talking about the S word. And don't mean sex, but this conversation is just as difficult to have with your children. It's about suicide. So what do you do when you think your child is suicidal? I mean, parents, already, how difficult is it to talk to your teens? They're at that age where they're exploring their individuality. Try to get them to clean their room. What kind of conversation do you have with that? What kind of feedback do you get? But how do you know when it's being a normal teenager versus being defiant because they're growing and still in that lifestyle development cycle, or if it's really something deeper? And what exactly are suicidal thoughts? Believe it or not, suicidal thoughts are not uncommon. And that's scary to think about, that at some point in their life, while they're living under your roof, your child may be thinking about killing themselves. So what do you do in that instance? So I just want to talk a little bit about how we actually define and what are suicidal thoughts. So it can be temporary, it can be for a few seconds, a few days, but here's the thing, you have to ask. Research has told us, and those who have actually survived suicide attempts say, the one thing that no one ever asks them is, are you thinking about killing yourself? And that's a scary question to ask, because you're thinking, oh my goodness, is this going to influence them? Are they going to start thinking about it now? But here's the thing, having that conversation goes a long way toward helping them think through and process whatever they're going through. They can come subtly. So think about the stress, and we were kids, we were teenagers before, so we know what it's like growing up, the regular teen angst that we deal with. But we're talking about feeling suicidal and feeling like there are no options. Oftentimes, that is more serious than the typical day-to-day teen struggles that we're talking about. So what are the risk factors? Let's take a look at those. What does it look like? Is your teen at risk? So some things to think about: a family history of suicide, mental illness, or substance abuse. Now, that's not to say that if they do have a diagnosis that there's cause to be overly alarmed, but it's something to be aware of. I think one of the most important things that we want to emphasize tonight is having a conversation. It's tough, it's difficult, it's awkward, but it's necessary. Misusing alcohol or other drugs, or have a history of drug abuse, engaging in self-harm. We're seeing this more and more on the rise as far as young people who are self-harming, either because they're feeling numb or to feel. It is an indicator, not necessarily that they will commit or are suicidal, but it's certainly something that we look for in terms of being concerned. Or exploring their sexuality or gender, for example, if they're gay, bisexual, or transgender, or if they have a physical illness, chronic pain, or disability, or terminal illness. So these are just some of the risks. So let's take a look now at the warning signs. Question. If you go home and look at your child tonight, can you tell just by looking at them that they're suicidal? Let me get hot nods, yes, no? No, no, no. So what do you look for? What do you look for? So noticeable changes in eating and sleeping habits. I know this is interesting because most teens, they stay up late and they get up early to go to school, right? So how do you really monitor whether or not they're getting enough sleep? Ask the question. Don't be afraid to ask. Unexplained or unusually severe violent or rebellious behavior. We're not talking necessarily about sneaking out of the house, but we are talking about those risky behaviors that they do not seem to be aware of the consequences. Withdrawal from family or friends. They're not your cute little boy or girl anymore. They seem to stay in their room all the time. Pay attention and ask those questions. Don't be afraid to ask. Here's the thing. They may get mad. They may not open up. But at least you're opening the gateway to have that conversation when and if they're ready. Agitation, restlessness, drastic personality change, talking or writing about committing suicide, and giving away prized possession. They no longer are playing with their Xbox. They give away their iPhone. That's a sign. It's something that we need to be aware of and look out for so that we know we need to possibly intervene. Or they're doing worse in school. Now, that's a tricky one because sometimes kids just underperform. But when you combine at least 2 or 3 of these elements, it is certainly cause for concern. You have guidance counselors and community resources to reach out to just in case you're needing additional information. So I'm going to turn it over to Amanda now because we have these warning signs where our kids are suicidal, possibly need intervention. So how can we help them cope? Life doesn't get easy. It doesn't come with a manual. Yeah, we've got the Bible and some self-help books to help us along the way. But how in the world do we help our teens navigate this space and become productive members and graduate high school? So Amanda's going to talk to us a little bit more about that.
Hello. Good afternoon. How are you guys? Y'all doing okay? Well, I want to talk to you a little bit about coping skills. So, coping skills are like a toolbox, really a mental toolbox for kids, a mental toolbox for you guys, because not only are the kids, the teens going through things, in turn that puts it on the parents as well. So the coping skills are used when you start noticing something on the inside changing. Can be used, hey, I might think it's too late. Well, it's not. Start using your coping skills. You're having the suicidal thoughts. Your kid's having the suicidal thoughts. Use the coping skills. When you notice the warning signs, use the coping skills. They can be used at any stage. So a productive coping skill that we like to see is not really focusing on the stressful side of the problem, focusing on how can I solve the problem? What can I do to solve the problem, right? So focusing more on, how to really solve it, how to really tackle it. And then, decrease the negative self-talk. That's going to help you solve the problem. If your kid is sitting there saying, you know what? I'm dumb. I can't do this. I made a 60 on this math test. I'm going to fail. Mom, Dad, I don't know what I'm going to do. Right? I know we've all heard some variation. It might not have been I'm stupid. It might just be, how did I do that? I really studied. I really did my best. Well, now you know what you need to study more on. Now you know what to focus more on. Look at what are ways to get through this? What are ways that we can better help our kids get through this? Do they need us to sit down and help with homework, which it can be a little harder now with technology, but, reach out to the teachers. What can I do to help the kid? Focus on the positive. Also relaxation. Maybe your kids never tried meditation. Meditation's great. Maybe they've never tried breathing. Breathing is wonderful. You can do it in your car in a parking lot, not while you're driving, obviously. Or, just anytime you need it, anytime you feel stressed out, use relaxation skills. Relaxation, it could be a walk, which leads into physical exercise. Walking, if your kid's stressed, hey, take a walk. Hey, take a hike. Maybe let's walk and talk as we talk through this. Healthy sleeping schedule. Are your kids sleeping enough? Are they staying up late to finish schoolwork because they have other things going on? Well, having 7 to 8 hours of sleep helps them rejuvenate, helps their mind reset, helps the next day they can have the right logic to get through the day, the ability to handle the stresses that come at them every single day. Planning ahead. Help your kids plan ahead. Do they have a test coming? Hey, do you need to study for 30 minutes today? Instead of, oh man, I've had softball going on, I've had basketball, I need to last minute study. That's going to add stress to the kid. So they need to be aware that planning ahead can really help. As well as being assertive, to speak up. As we discussed this morning, assertive skills to speak up for the kids, it's important. It's important that their voice is heard. It's important that they're not felt like they're pushed to the side, especially if they are having mental health problems at that time. Making sure they are heard, making sure, hey, Mom, hey, Dad, I'm stressed out. Hey, I can't handle one more thing. Oh, you'll be fine, little Susie. That's not the correct response. Kind of what is going on? Why does this feel overly stressful to you? And then the last productive one is seeking support, social support. It can be a club that they are with in the community. It can be friends. It can be anybody, as well as spiritual support. If they feel like they need to talk to a pastor, preacher, whatever you may call your spiritual support. Praying, that's welcomed, as well as professional support. We've got therapists that are really good, Willowbrooke, we got it at Floyd, we have it in the school systems. Here, I know Willowbrooke at Tanner has it here in the school systems. So seek out professional help, or the kid if they need it. Non-productive, worrying. Is worrying going to get you anywhere? Not usually. It'll get you to stress out more. It'll get your kids to stress out more. And that's not going to help if they already have the self-defeating thoughts of, I can't do this, I can't go on any longer. That's just, the worry's just going to help reinforce it. Wishful thinking. I don't want to say wishful thinking, don't confuse that with optimism. Like, I want to be a doctor when I grow up. Wonderful. Try to achieve that. But the wishful thinking of, I'm going to get out of this situation if I do X, Y, and Z. I'm going to pull myself out if I do X, Y, and Z, and it not be something that is attainable. That's where it becomes the issue. Not coping at all. Just ignoring it. Just thinking it's going to go away. That just makes it worse. For that time, I'm just going to push to the side and I'm going to do this. Okay, but what happens when that next stressful situation comes at you? It's just going to further deepen. Self-blame. If I wouldn't have done that, then I wouldn't be in this situation. It's my fault that this happened. Or I caused this to happen. Those kind of thoughts can be detrimental to a child who already has self-defeating thoughts and thinks that they're not good enough. Then you have isolating. So isolating can be, they go home, they go to their room. You don't hear from them, or you hear from them because they want to come eat dinner, and then they go back to their room. Self-isolating can also be coming home, I'm going to play on my Xbox, I'm going to avoid everybody else, and then I'm going to go to bed. Sometimes that's normal for kids, but sometimes it's them isolating, not wanting to face what's happening in the real world. So before we move to the next slide, I just want to kind of bring a personal aspect to this. So going through school, from the time kindergarten up until 7th grade, I was bullied. And I was born, with a lazy eye. So, of course, it's noticeable, not something that I could really do anything about. But, I was called everything from lizard eyes to you name it, from kindergarten up. I would tell the teachers, the teachers, of course, little Johnny, don't say that, or little Susie, don't say this. But I would still go home crying. At least once a week, I would go home crying to my parents. Why did God make me this way? That's why was I put here to have this? Well, 7th grade, I ended up taking up for myself. And it was, I would call it was productive but non-productive at the same time. It was not a way that I would suggest. So I took it into my own hands. Me, little 7th grader, probably 80 pounds max. I heard talking in the middle of the classroom. The teacher happened to have left the room. What did I do? Let my emotions get the best of me. Slung my math book, and I can visualize this, slung my math book across the room, hit the wall. I stood up. I said, "What did you just say?" This poor little boy, picked the desk up because I was so angry, and I dumped him out of his desk. And I said, "That is the last time you will talk to me that way. That is the last time you will talk about me like that." Did the bullying happen anymore? No. But I was the one who solved the problem in a non-productive way. I could have probably gone about it in a more peaceful manner, but I let the anger get the best of me. After that, of course, we had a meeting with the teacher. No, I didn't get in trouble because, I kind of explained what was going on. But at the same time, the little boy, he apologized. He said he was sorry. I was not ready to hear that apology. So to this day, we've made friends. We're fine now, of course. But there's little things, like that's not the physical bullying that you think of. But it happens. It happens all through school. Whether the kids are going to tell you about it or not, little comments like that happen. And I'm a parent as well. I've had my daughter come home, and she's just absolutely in tears crying. I said, "What happened?" And she'll tell me the story about what had happened. And she's a little dramatic. She's 10 years old. What 10-year-old's not? So in my mind, of course, therapist mode kicks in. And I talk to her, and I say, "Adeline, honey, are you having thoughts of killing yourself?" I'm preparing myself. What if she says yes? What do I do? What are my therapist steps? What has been taught to me? What do I do? What do I do? And she just looks at me and she says, "No, Mama, I would never do that." But not every kid's going to have that response. Not every kid is going to say, "No, Mama." There's going to be some kids who say, "Yes, yes, I do." And we need to be prepared to know what to do when our kids come to us and our kids say, "Yes, Mama, yes, Daddy," or aunt, uncle, whoever they live with, grandma, grandpa, "I feel like I am going to kill myself." So we need to know what to do from there. And a myth is young people thinking about suicide can't help themselves. We think they are just unable to help themselves because they're not in the right mind to help themselves. Well, at that point, they might not see the world from the perspective that we see it. They see it from the perspective as what they're going through at that time. And we need to know that. We need to be there as support. We need to be there for them to help talk them through so they can get to the point where they are able to help themselves. They are able to, you know what, I do need to get that support. I do need to get that help because I know I need it, and I know my family needs me to be here, and I need to be here. So, with that being said, if a person attempts suicide once, there's no guarantee that they won't attempt again. We think they attempted it once, they know it's a mistake. They may, or they may not. So there's no guarantee that these coping skills or any other coping skill, listening to music, there's no guarantee that it's going to work. But we tried as parents, as friends, as adults. We are there for them to help prevent. And that is the purpose, is to help them prevent. So there are some apps, because kids are all in their phones nowadays. Even as adults, I'm in my phone and I have mine that says, hey, you've cut down 10% this week. Great. But there are apps for kids, for adults, for anybody. So there's meditation apps, there's mindfulness apps, there's sleeping sounds, there are apps that help you breathe. There are apps that have soothing sounds. Sometimes if they have racing thoughts, maybe they need something, put in their headphones, listen to the sound of rain, or the rainforest, or maybe listen to someone helping them meditate. A lot of these, they do have like a 7-day free subscription. There are several good ones, but that's something that you will have to individualize. The student, the kid will have to individualize to what works best for them. What do they see is best for them? So just to bring it home, communication is key. Communicate with your kids. Encourage them to communicate with others. That is going to be number one tool in the toolbox, is communication. That's the only way we're going to be able to find out and help them cope and help them use the coping skills and help them not become a statistic. And that's what Holly is going to talk to you guys about next, is the statistics. So I will turn it over to her.
Thank you. All right, so before I pull up my slide with the statistics on there and we start talking about them, first I'll tell you the data that we're looking at and that we're talking about is from 2019. So 2020 data has not come out yet, so 2019 is the most current that I have. Does anybody want to take a guess at some of the numbers that we may talk about? So let's say the number of suicides in the whole United States for 2019. Anybody want to take a guess? What about in Georgia alone? Hundreds? Okay. Well, I'll show it to you in a minute. So we'll remember, hundreds. Okay. So I'm going to pull my slide up. And thank you for... I'm going to try to pull my slide up. There it is. Uh-oh. All right. So in the United States in 2019, 47,511. It's the 10th leading cause of death for all age groups. In 2019 in the United States, for the age range of 15 to 24, there was 5,954 deaths from suicide. It's the second highest cause of death in the age range of 15 to 24. All right, so Georgia, we talked about Georgia, 1,582. 299 of those were 15 to 24-year-olds. And the point at the top, that kind of stands out to me the most. We average one young person, so that 15 to 24-year-old age group, every hour and 20 minutes in the United States. So that means while we're in this room doing this presentation, somewhere in the United States, we're going to lose a 15 to 24-year-old to suicide. This is why this is so important to have these conversations. Okay? One thing that I'll also bring up, men are more likely to die from suicide. Men typically use more lethal methods when they attempt suicide, so they typically carry that out more often. Women are more likely to attempt and use methods like overdose, poisoning, things like that. All right, so we talked about Georgia, we talked about the United States. So let's talk about here at home. Let's talk about Polk County. 2019, there was 10 suicides in Polk County, 8 males, 2 females. And then I also included the surrounding counties for 2019. So Floyd County had 25, Paulding had 28, Haralson had 9, and Bartow had 29. And you can see up here on my slide the breakdown of male to female on those. Higher prevalence of male than female. So that's why the coping skills that Amanda has talked to you about is so important. Deb's going to come and talk to you about resiliency. And our hope with all of this is that we lower these numbers.
All right, so we know, am I on? Yes, okay. So we know that because of what has happened in Polk County, we've got some damage control. We've got some recovery that we need to make happen. We know that just by the numbers that were just reported, we've had tragic accidents in Polk County this past year. We've had unexpected medical deaths. We've had so much hit just this school system. But we know that the students are involved in the community. And so now we're talking family members. Now we're talking all the other people that touches. And so, I mean, just exponentially, we're growing with the amount of people that some of these events have touched. And so we know just by sheer exposure and just by sheer knowledge of what has happened, we've got a lot of people who are grieving. We have a lot of people who are trying to figure out, how do I respond and how do I move past all of these things that have just happened? And so sort of these next few minutes, what I want us to talk about is, what does it look like? How do I even know if I'm grieving? And so this morning when we got a awesome chance to kind of touch base with a lot of the students here in the school system, we talked about, how do I even know if I'm doing that? How do I even know if I'm grieving? But we also know that you as parents have weathered a ton of trauma. You've weathered a ton of exposure to things that have happened to your child or just by association because of their friendships. I mean, I'm looking at some of the school counselors that we've shared stories just in the last few months. My kid knew someone who knew someone, and we stayed up all night talking about it. My kid who knew someone who had relationship with someone now can't eat, now is struggling in their academics, now is all these things. So I wanted us tonight to take a look at this slide. What does grief look like? Because it can show its head and rear its head in a lot of ways. So, am I noticing that people are more anxious than before? Am I noticing that the people that I'm around, or even myself, am I starting to not sleep so great? I used to be able to lay my head down and sleep fine, but now I find myself waking up multiple times. Am I grieving in ways that now I'm just irritated a lot? Stuff that used to be no big deal to me now just irks, and I can't let it go. We've got to pay attention to some of these signs of grieving and some of these signs of reaction, and if we don't ever talk about it, we won't know what to look for. And so tonight, I'm asking you as parents and adults and loved ones of those that have dealt with and who are continuing to experience some of the aftermath, these are the things that we want you to pay attention to. This image that we've put up here, Oftentimes, you guys, our kids and the young adults in this community, they feel like they are the only one. They feel like they are sort of the singled out one amongst many. No one else could possibly be feeling what I am. No one could possibly know what I'm dealing with. And we're here tonight to tell you that it's happening across this community. There is so much commonality and so much connection between some of this stuff. And so this morning we really talked heavy, and we want to talk to you tonight heavy just about there is power in numbers and there's power in being able to connect and use the people around you to help weather some of the stuff that's happening, okay? So we're talking about grief tonight, and we're also wanting to talk about just how does it rear its head? With this particular image, you know, we can really look great on the outside. We can look like this beautiful creek with these great flowers and all these adornments that we put on ourselves. But underneath that surface, there's really jagged rocks, really sharp, nasty terrain. And our emotions can sometimes feel like that. And so we're using some of these images to kind of communicate tonight. On the surface, we can really put on a good front. But if I'm genuinely grieving, I'm hurting. And I got a lot going on inside. And if I don't have outlets and ways in which I start to do this and deal with this and create some momentum that gets me moving forward, I can really find myself stuck in a place for a pretty long time. I can grieve and I can really react to certain situations that have happened around me and to me for quite some time. And so what we're trying to do is help this community and continue to support this community with ways that we can continue to move forward. Okay? So some of these ways, and we want to give you tangible, practical things, okay? So we know that there are just dark moments in life. We know there's dark stuff, situations, circumstances, relationships, dark stuff. But we also want to make sure that we balance that with the light stuff. What are the things that I do have in my life, or relationships that I do have that are healthy, or that are helpful, or that are uplifting? And so helping, again, this morning talking to the kids, and then tonight with you guys, tonight as the adults, how do I focus on both? That helps me and move me forward in my experience with grief and in my reaction to the things that I'm trying to get past. Other things that we want to talk about with you guys tonight is just discussing things that are also helpful and healthy and exciting to the kids in your life or to the adults in your life. When we're grieving, oftentimes it's easy to stay focused on the negative, to stay focused on the circumstance or the thing that has sort of triggered my grieving process. And it's okay to talk about both. When we've had maybe a death in our family, and sometimes it's struggling to know, is it okay to talk about something other than just the death with them? And the answer is yes. It's okay to bring up conversation about other parts of their life. This helps us gain momentum towards other parts and other places that our grief can take us. We don't have to stay in the same place each day after day. So the tough part is, how do I balance? How do I continue to juggle what has happened around me and to me and amongst those that I love and that are special to me? But how do I move forward without feeling like I'm denying it or ignoring it, or maybe feeling like I'm not balancing it? So these are some things that we want to kind of talk about tonight with you as well. This thing is really lagging. Okay. So there's this key word that we want to talk about tonight called resiliency. What is it? And if I were to ask every single person in this room, I'd probably get a different definition from every single one of you guys in terms of what does resiliency look like. But by definition, what we know is it's how do I adapt in the face of difficult? How do I adjust in the face of just junk? Things that we don't invite into our life, things that we wish never happened. But how do I move past, and how do I see tomorrow in a different light? Our capacity to recover. You know, if I had a tennis ball, it bounces right back. I shove it down, but it comes right back up. And so resiliency is just our way to be able to kind of spring back from what I was versus where I am now. And for a lot of people, and myself included, you guys, life events, they can change us for the duration. Some of these events that our students and our kids and our families and our community is dealing with, it can change us for the rest, you know? And so tonight we're not talking about resuming how I was or what I was. What we're talking about is moving forward and moving past these events so that they become all-consuming and become the only thing that we focus on and deal with, okay? So if you can kind of envision this concept or this image of an airplane being hijacked. This is someone coming into an airplane and taking over full control and saying, you are now mine. You guys, to a lot of our kids and to a lot of our community members, our reaction to these traumatic events and to these big deal events that have happened, especially in Polk County this past year, it can almost feel like that has hijacked our ability to function. It's hijacked our ability to manage and navigate our reactions and our emotions. And we're here tonight to say, one, expect it and know that it's going to happen, but we don't have to stay there. We don't have to necessarily live in a realm where our emotions kind of take over and completely dictate and control how we react to things. That's what we want to try to make sure that we talk about. So can I regulate my emotion? And if the answer is no, then we want to encourage you to reach out and ask for professional help that can help you begin to navigate that. The idea is that we don't stay where we are. We continue to access the support and the avenues that are available to us so that we can kind of move past that idea of being taken over by that stuff. So tonight, if I put this down, that's okay? And this will start up? Okay. So tonight, again, we want to give you tangible things that we can do alone, with other people. Doesn't cost a dime, doesn't require a piece of machinery or an app or anything like that. But what I want us to do tonight is walk through an activity that will allow us to be able to kind of calm ourselves down and control ourselves in the moment. So whether we are doing this with a kid, with ourselves, with our family, all the above, okay? So what I'd love for you to do is just put your palm up in the air, okay? And if I'm in a state of worry or anxiousness or just in a place where I feel like I can't even handle my own skin because life is just so out of sorts for me. What I want us to do is to practice this idea of breathing, and what we call this is starfish tracing. Okay, so your hand kind of resembles a starfish because of the 5 points. And as I take my index finger of my other hand, what I want us to do is as I trace the outside of my thumb really slowly, I'm going to breathe in as my finger increases on the outside of my thumb. So I want to breathe in. So if you'll do this with me, take your free hand, and I'm going to trace the outside of my thumb up as I breathe in. And as I curve the top and come down the inside of my thumb, I'll exhale and breathe out. As I trace the inside of my index finger, I breathe in. And as I round down and trace down the outside of my finger, I breathe out. Again, with my middle finger, I breathe in. And then I round the outside and breathe out. I trace the inside of my ring finger and breathe in. And I trace the outside and breathe out. One more time. And then breathe out on the outside. Okay. Now for some of us, I'm going to trace my hand about 15 times because it's going to take me that many times to relax and calm myself down. But to a student, to a kid, to an adolescent, to an adult, you guys, we are starved for healthy ways to cope with our circumstances some days. And I can't afford a therapist every day. I can't afford the fancy this and that. I have a hand and I can trace and I can breathe. And that's the idea, is we want to give these guys tangible, realistic ideas that they can use to kind of relax and calm themselves down from where they might have been or where they want to go, okay? So we're coping, but not always in healthy ways. And so we want to make sure that our students hear from us, and you guys hear as parents, ways in which you can teach your kids how to do this very, very practically, okay? Here's the cost if we don't do something about what we're talking about tonight. You guys, these cycles that will continue to repeat, there's a reason why suicides happen in clusters. There's a reason why Polk County in this area has such high suicide rates. It's because we know that if we have someone close to us or a hero who has thought that suicide was an option, hear this, I am now 7 times more likely to consider that as an idea that's a good idea for me. So when we're talking about communities that feel like, man, why does it keep happening in that area? That's why. The more it happens, the more likely it is to continue to exponentially grow. So we've got to figure out a way to stop the repetitive cycle, because if we don't, we know the cost. And I don't know about you, but we're all not willing to see that cost come to fruition. And so we are past thankful that those of you that showed up tonight and those of you that are streaming, it's worth the effort and it's worth the conversation, because it's not going to go away if we just hope that it ignores it and hope that it just solves itself. That's not what this topic and this idea, that's not what happens with this, okay? The other idea that we want you to think about is, could you imagine turning your car on, keeping it in park, and just ramming your foot on the gas for hours on end? Could you possibly imagine what that would do to your car? You'd wreck it, right? I mean, you'd totally ruin your machine. You wouldn't have transportation. You wouldn't be able to do anything with the car that you've just spent all this effort and time. We don't do that to our cars because we don't want to overtax it and overuse it. But that's what we're doing to our bodies right now when we stay on the ramming speed of our schedules and our emotions and all the stuff that's flooding us, and we never take our foot off the gas. We keep going forward and we keep trying to press through, and we don't pay attention to the things that we've learned already tonight. And so it's just this concept. It's ineffective, it's unproductive, but guys, it's damaging. And so to our students that are in our classrooms, and you guys as parents and community members who are interfacing with our kids, we've got to start addressing it and talking about it, because that's the benefit of, or the risk, so to speak, of not following through. Okay? There's also this concept of get-mo, good enough to move on. This morning we talked about this idea. You know, I have a master's degree. I've never had one person ask me what my GPA was. All they care about is that I got it. And so for some of us in some of our days, we're trying to have these magical, beautiful, amazing, wonderful days. And sometimes our days are going to look like it's just good enough to get by. It's just good enough to move on. So if I don't look a certain way one day, no big deal. If I don't go to every single event that I'm invited to go to as I'm grieving and working through these reactions to things, it's okay. Good enough to move on is what we're going for when we're talking about responding and grieving and being resilient to situations. Oftentimes we need the permission to not have to feel like we have to resume everything that we did, or to be a part of everything that's out there and as an option for us to be a part of. Good enough to move on is sometimes good enough, okay? Okay. Guys, this is not a recommendation. This is not a, if you feel like it, it's a good idea. This is a fact. There is value in numbers. And research tells us that if I am struggling, I am more likely to have momentum and move forward and move past in my grieving process and show greater resiliency if I'm doing it with somebody alongside me. Okay? So for those kids that are isolating, those kids that feel completely by themselves, we as adults, we need to be able to say this kind of stuff to them to remind them there is value in numbers. Doing this on your own, you have a whole lot less likelihood and a whole lot less of a chance to really move past and continue the momentum of grieving and being resilient with whatever the circumstance might be. I am less likely to stay where I am today if I have someone sitting next to me or someone who holds me accountable and calls me and is involved in my life who can press me further, okay? So as we close tonight, and we're going to, again, offer opportunity to ask questions and kind of have just some dialogue, whether it's virtually or in person or after we kind of dismiss and we just want to do one-on-ones. But I want us to talk about tonight about these key questions. And I'm asking you as the adults, but I'm also hoping that students that have either streamed in or others that you will talk to eventually. I want us to be able to ask these 4 key questions, these 4 crucial questions that are pretty critical to any of us thriving versus just surviving. Do I believe that I have a place? Genuinely, do I believe that I have a place? Do I believe that I actually can do it? Do I believe that I can do what I really want to do? Do I believe that I can make a difference? Wherever I am and whatever I'm involved in, do I believe that I can make a difference? And certainly last but not least, do I believe I have what it takes? Now, these are big questions, and some of us as adults sometimes struggle to say yes to these. But if I say no to any of them, these are areas that we would love for you guys to reach out to other professionals or to other people in this community that can help you and hip up alongside you and connect with you so that we can help you move past wherever it is that you feel stuck. This morning that we talked about, my physical education teacher is not a therapist, but if I feel comfortable going to that person, go. And they know who they can connect that student up with. If I'm a parent and I don't know who to ask, you go to someone at the school and you say, look, I don't know how to help or support my student. Can you help me? Ask the key question, and I guarantee you that this school system and this community will connect up and provide support wherever it is that you feel like you might be. You guys, tonight was not a presentation that you just came, kicked back, and then leave the same. We want you to walk out of here having some tangible, practical things that you can implement and actually use walking out of here. Because the cycle is not worth the cost. This repetitive cycle that we're starting to see, not just in this community, but in others, it's too costly to be quiet. And so we're grateful that you allowed us to come. We're so grateful that the school system said, let's do this. But this is just the beginning. And so we just invite you to join us and invite you to implement the things that we've talked about tonight so that some change and some movement and some momentum can start happening. So just thank you.
Thank you all for just some great information. We're going to have an opportunity for some question and answer in just a second, but before we do that, I just felt like it might be important to say, there may be folks that are watching on the stream tonight that came across this because they're considering suicide. They may have, Googled it and found this or whatever the reason may be. So if you might be that person, the National Suicide Prevention Lifeline is 1-800-273-8255. That's 1-800-273-8255, and we encourage you to call before making that decision. It's just so important. Okay, I have some questions that have come in, so we're going to ask those. If any of you in the room have questions that you would like to ask, if you'll just kind of signal to, we have Mrs. Atkins and Dr. Thomas and Mr. Teams in the back. If you would signal to one of them that you have a question, then they can pick it up if you'd rather not ask it in person. If you don't mind asking it out loud, we do have someone with a mic. You can do that. But we had some questions that had been submitted. And one of those is, and as we ask some of these, I know y'all touched on some of this, but it might not be a bad idea to reiterate. After someone dies by suicide, what are your thoughts about how that should be communicated, not only to the community, but to maybe peers, and should that vary by age group, and how do you differentiate how you talk to, maybe adolescents versus, elementary school kids?
Okay, so that's like 17 questions in one. And I may ask you to remind me some of the things that were posed. So, you guys, death by suicide is different. It's not the same as a car accident or dying of a chronic disease. It is different. And so we know that the grieving process and just the community impact is different because of the stigma placed on suicide and just sometimes the shame or the embarrassment. I mean, if we're real, a lot of people just say, oh, they've just perished. And we never know the reason. Or it's very hush-hush and only kept in private doors. So, I think people struggle with this answer, and I want to be very clear. There's not a one-size-fits-all. And I think each community has a different responsibility to itself in terms of how they respond to suicide. But generally speaking, you talk about it. Generally speaking, we're not focused on the method of the death, but we're focused on the life of the person. And, privacy is important. Privacy is very important to families, of course, and so they're going to use the discretion that they feel comfortable with. There is no blanket reaction. And, you guys can certainly fill in gaps if I'm not sharing those types of things tonight, but the idea is that we're celebrating the life of the person and not so much the method when it comes to that. So, do I talk about it differently with a 6-year-old than I do a 17-year-old? Sure. And you answer questions as they're asked, but you don't give the same presentation to each person that might need the response about what happened. And so, developmentally, there's 10,000 answers to this question, but the idea would just be that as young children ask questions, it's okay to answer them. If they're curious, it's okay to sort of squelch their curiosity and answer their questions. But we don't have to necessarily go into a full presentation with a 5-year-old. We can answer their questions and continue to celebrate the life of the person versus the method.
Okay. Thanks, Deb. Other thoughts? Okay. How about, so there are sometimes cultural stigmas based on ethnicity or religious background that view suicide differently, and because of that, someone who's struggling with these thoughts may be reluctant to talk about those. What would you say to encourage those that are in those situations where they know that there may be a strong reaction because of that ethnic or cultural religious background?
I think that's the thing that makes it such a difficult topic, but the answer is pretty much going to always be the same. Talk to someone. As difficult as it is, especially when you're told if you kill yourself, you're going to hell, whatever it is that you're being told, that's kind of combating those thoughts. The general idea is there's help out there. There's a person that's willing to listen. Just talk.
Yeah, you guys, mental health knows no culture. It's not that certain cultures don't have to deal with mental health or lack thereof or less of. So it may be more accepted in other cultures to reach out and ask for help, but at the end of the day, it's identical. The point is you need to tap into someone who can help you navigate what's going on with you. And the healthiest of adults don't have every answer. And so there's not a one of us that doesn't have mental health needs. The best licensed counselors need their own counseling sometimes. And so sometimes the stigma prevents us, but at the end of the day, it knows no bound.
And I think along those lines, if we have a broken arm, we go to the doctor. And
Even
so,
doctors go to the doctor.
Yeah, that's right. So this is no different. If you're struggling with these types of issues, don't hesitate to reach out and see a doctor or see a counselor. What would you say to a family that, who they have a family member who has talked about suicide, but they assume that, well, that's, it's copycat behavior because it's happened recently, or they're just being dramatic. How would you encourage that family to handle those situations and get past that thinking?
You can't afford to assume in an instance with a topic such as this. If they are talking about it, whether it is for attention, whether it's attention-seeking behavior, whether they really want to end their lives, it's always best to err on the side of caution and talk to somebody. So I don't get myself.
Yeah, could you repeat that? Sorry.
In an instance where we're talking about suicide, it's always best to err on the side of caution. So whether they're doing it as attention-seeking behavior or whether there really is an issue where they're seriously considering ending their lives, again, it's always best to seek professional opinion, talk to someone, because you never want to assume and possibly be wrong, because there's no coming back. So whether they're doing it for reasons that may not seem sincere, it's too serious of a topic not to reach out and seek professional opinion.
Are there, and I know again that you touched on this, but maybe it's a good time to reiterate it. What are some of those maybe common signs that teachers should watch out for? They may not be with a student all day long. They may see a student for 50 minutes of the day. So what are some things that they should be looking out for?
I don't mind going over those again. If we're noticing some unexplained or unusually severe or violent rebellious behavior, if we're noticing that they're withdrawn, And that's a tough one, because how many of you have teenagers who would rather stay in their room rather than socialize with the rest of the family? But it's something that's noticeable and pervasive, and it's really unusual. Agitation, restlessness, irritability, talking about or writing about suicide. And this is one that I struggle with, because now there's a lot of artistic expression, we'll say, with musicians and artists who talk a lot about suicide. And there are so many of our kids who are gravitating toward that as an outlet. Not necessarily saying that they are actually thinking about it, but it is a concern, and talking about it, gravitating towards songs, poetry about it, is a warning sign. Doing worse in school or giving away prized possession, those are some of the biggies.
Anybody else? So that's got to be tough. I mean, because I remember being a teenager, and you are moody very often, and so it's got to be difficult to. But I think, Monica, what I'm hearing from you is always err on the side of caution.
Always err on the side of caution. And again, if they're moody, as much as they may snap your head off or ask and say, hey, do you want to talk? Believe it or not, even as they're gravitating through high school, even though they're continuing to gravitate through the life cycle, kids still want you in their lives. Even though if you're above the age of 21 for some reason, you're lame to kids, there's still a level of expectation of them wanting you to take care of them, wanting you to be concerned. And even if they are withdrawn, if you don't ask, it's not going to get any better. If you do ask, they may bite your head out, but at least they know that you're paying attention and you're listening.
In addition to that, I just want to say, I may ask my child, are you okay? And they're going to say, yeah, I'm fine. I'm perfectly fine. Nothing's wrong. I'm just moody today. I don't know why. A week later, you remembered you asked me what was wrong. You seemed really concerned. Well, let me tell you what was wrong. So it's not always you're going to get an immediate response. Sometimes it's a delayed response, but your kids hear you. It just might take them a little while to feel comfortable to open up.
Okay. Do we have any questions from the audience tonight? So we have one down front here, Jim.
Is this on? I'm a very shy person, so I needed a microphone in order to ask my question. This is a serious question, though, but I think one of those questions was submitted by me, and the thing that the question that I have is when you, as a professional, as a teacher, as a counselor, see that there's something there with the kid, you approach the family, and the family is dismissive. Whereas the kid is giving you indicators that there's something really there, but the family is very dismissive. That's do you guys have any ideas about breaching that with the family? Because you want to be wrong. The goal is to be wrong in this situation. However, it's like, how do you breach that with the family so that we can be wrong?
Again, when it comes to being a teacher, we as professionals, we're mandated reporters. So if there's enough there that concerns you, that something needs to be addressed, sure, we take it to the family and we hope that they follow up. But as mandated reporters, you follow the trail and you make the report if you need to, if it's significant enough. If a child is threatening to hurt themselves or someone else, that goes beyond what any parent can respond to.
And you keep bringing it up. Keep going to the parent, keep saying, here's another concern, here's another concern. Guys, if we use the illustration, if we had a student or another kid, and even our own kids, if they had symptoms of an ailment or symptoms of something, we might dismiss the fierce few. But if I keep seeing it and they keep having, headache after headache, eventually I need to go to a professional and get that looked at. But if it's a one isolated report or one isolated symptom, I may not be as likely. So the more that it's brought to their parents' attention and the more that it's brought up to their knowledge, not always, but typically we see, okay, now I'll move. I can't ignore the fourth concern or the fifth report because I've continued to make it aware.
I would also say to make sure, and when you talk to the parents, every time you talk to them, here's a resource, here's a number, because they might not be willing to take it from you and you think they're dismissive because maybe they don't want to admit that that's going on with their precious child, right? So give them the resources every time, and you never know. One of those times they'll be like, you know what, you're right, I finally see it. I'm gonna call this number that you gave me 6 weeks ago. I'm finally gonna do it.
What advice would you have for a student who they're not dealing with suicidal thoughts, but a friend is? Maybe the friend's confided in them, or maybe they've identified some of those risk factors you're talking about. How would you encourage a student to handle that with their peers?
Yeah, I mean, you guys, professionally and personally, I can kind of answer this question. We are not all born trained counselors. We wish we were. We all feel like we're great listeners, and people come to me and tell me all their stories, but we're all not trained counselors, and so we've got to make sure we connect it up. Again, if somebody came to you and said, man, I'm having this horrific headache day after day, as a friend, would I just dismiss it, or would I say, let's go talk to the nurse? Let's go to someone who can help you and ask you the key questions. And so counseling's no different. To adolescents who have peers who are bringing things to their attention, please do not keep that to yourself. Please do not bear the weight of having to help your friend fix and navigate through all that. It's too costly of a weight for you to bear. And there's too many people around you that can help support and connect that up to professional help. So long story short, go tell an adult.
Great advice.
Yeah.
Any other questions from our audience tonight? Yes, sir. Jim, one down front.
Yeah, my name is Father Tim Gallagher. I'm the pastor at St. Bernadette. We suffered this recently, and just, thank you for this talk. Thank you for responding for the need in our community that cuts across cultural and language barriers. And so I think this is a great first step, and hopefully we can continue to walk together and find solutions. Praying for y'all in your ministry, which, that's what it is. Saving lives, very important. It's what our Lord came to the world to do. So thank you. So I just wanted to maybe ask, what is is there evidence out there of people who've thought about this seriously, and there's something that brought them back out of that? I think y'all have mentioned to that some in general. How good is that testimony? Because it seems like, the attraction is when the popular person does it or somebody grabs attention, it begins to snowball out of control. If there's some opposite reaction that is in a positive direction, that's one thing. And then another thing is, you mentioned bullying. Is it Amanda?
Mm-hmm. Yes.
How much of that is a cause, and how willing are schools, is there resistance in schools that you see as counselors to admitting that being an issue, a problem?
Well, I will say I'm not a counselor in a school. I personally don't work with kids now. I have in the past. So bullying can be a factor of pushing that student to the edge. But it is our responsibility as adults, if we notice it, to help them go the right direction, to help them use their coping skills, to help them go to the adult. And I'm sorry, I forgot what the first question was. I have a... Is there
people who've been brought back?
Right.
Once they've, yes, okay, so there are different things that help everybody. So everybody is individualized. There's not just one magic thing that will help them. We wish there was. Like as social workers, as therapists, as counselors, we wish we had that one that says, you're no longer going to have these thoughts anymore. But being in practice with patients, it is I looked over before I did it, and I saw my dog. Who's going to take care of my dog when I'm gone? It's who's going to take care of this when I'm gone? Well, I've got my kids. I don't want, or the kid, I don't want my parent to find me that way. So sometimes it's not, there's not really like a blanket answer, like you said, there's not one.
I think, too, I would add to that, some people, they make a phone call or they reach out to somebody and say, I'm having these thoughts, or I was thinking about doing this, and that person takes them seriously. And they listen to them, and they talk to them, and they help them find that help. So, again, I know we keep saying it, but that communication and taking it seriously, if somebody reaches out, I think is a...
I kind of wanted to say a couple of things. One of the things that we call preventive in counseling is if they are at risk for suicide, then, well, really for all of our patients, we do what's called a crisis safety plan. And in that crisis safety plan, we help them outline and plan. What are your triggers? What are your warning signs? What do you need to look for and be aware if you're headed toward a crisis, if you're feeling suicidal? What are your internal coping skills? Who would you call? And we give them a list of resources that they can call. So the idea is that hopefully, and that's, again, in a therapeutic setting. That's certainly not every day and not necessarily with students per se, but it's certainly a tool that we use to help folks kind of talk themselves off the ledge, so to speak. A great example, I think his name is Hines, but he actually survived jumping off the San Francisco Golden Gate, Kevin Hines, jumping off the Golden Gate Bridge. And one of the things that he says, and he says that he's heard this, and we have researched this and know that this is true. He said when he made that jump, the first thing he thought was, man, I wish I hadn't have done this. He was able to survive, thank God, but think about the people who weren't. So there's not an opportunity to get a second chance to rethink it or change your mind. So it really is about providing them with the resources before it ever gets to that point.
For anybody that's listening tonight, and especially here as well, if you are thirsty for more information about this topic and just how do I react, what do I do, an incredible training that is free to anybody across the world, Youth Mental Health First Aid. Kevin Hines is the spokesperson for that material, and we've actually presented a lot of portions of that to the Polk school system. But Youth Mental Health First Aid and Mental Health First Aid for Adults are two very good resources if you're interested in learning more. Why didn't they do it? This training teaches as well, because somebody asked the direct question, do you want to kill yourself? They didn't dance around it. They didn't ask, hey, you want to go to a movie? Hey, you want to just hang out? They went straight for the question, and that allowed the person to have to answer yes or no. There was no gray. There was no question that was leaving it arbitrary or sort of vague. And so what we know with someone, if you think it or you question it, go straight to the question and don't dance around it, because we've got to find it and we've got to get them connected to the professional help.
What was the training called again?
Youth Mental Health First Aid.
Okay, great. Any other questions tonight? Okay. Well, please, if you have questions later, you can find us online. Floyd Behavioral Health is part of the Floyd healthcare system, so you can go to the Floyd Medical Center website, Willowbrooke at Tanner. You can Google as well. They're part of the Tanner healthcare system, and they're in Villarica and Carrollton and that area of the state. And Willowbrooke at Tanner provides the counselors here at Polk for the Polk School District. Floyd Medical Center provides the school nurses here. We have school nurses in all of the schools around Polk County. So there are ample resources available for your students in Polk County. And in the Polk School District in particular, we should say that this isn't a crisis that just affects adolescents. So if you yourself are watching and you need help immediately, the National Suicide Prevention Lifeline is 1-800-273-8255. That's 1-800-273-8255. They have service in English and Spanish. So by all means, make that call before you make a decision. And then talk to someone. Talk to a counselor, talk to your pastor, talk to your youth minister, talk to the counselors here at school or your school nurses. You know, even if you feel like you can't talk to your parents or maybe you can't talk to a teacher, there are people here that are willing to help. So we can't encourage you enough just to talk to someone. Thank you so much for great information. We appreciate that. Thank all of you for joining us both in person tonight and online. This is going to remain available online. We'll share it on our social media through the healthcare organizations, and I'm sure the Polk school system will as well. So this will be archived. If you've been here tonight and you think, gosh, I know someone who really could use this information, it will be available to you to share. So we encourage you to do that as well. So thanks for joining us, and be safe. And if we can help in any way, just let us know. Thanks.